There's a lot of areas in which creative health can interweave and fit in. And I think it fits in with a lot of contexts within public health and creative health, within any kind of setting. And I think it's been open to explore the research and explore the evidence base, because it is there. If it's the plethora of public health outcomes across the 4 domains, I think it's having that open mind as a public health professional to the value that creative health can have, both on your work, but for everything, the citizens and the patients that you're serving.
What does the art mean? And for me, it's probably 3 things. One, it's we've got a collective group here today. How do we influence? How do we persuade? How do we cajole? How do we support others in terms of that collective efforts to be creative? Because again, the sum is much greater than the parts. It could be physical, it could be visual, it could be digital, etc. So, and how does that influence people's well-being? It's not just the health; it is the well-being. And I think thirdly, in terms of that art, it needs to be accessible. So if we talk about public health, those collective efforts, everybody needs to have that contribute, and the art of getting everybody to contribute is sort of the previous 2.
We are now we've started a task and finish group to bring together the key stakeholders across the region, across the country actually, to learn from them, collate the evidence, make sure we have a robust theory of change developed, and ensuring that it is an integrated approach. So it's not something which is isolated from what's happening on the ground. Once we have that, I think then what our plan is to be able to invest in some test and learn pilots, and then build that into the evidence base and contribute to the evidence base nationally.
Also have for our creative health programs a minimum data set whereby we collect lots of quantitative data. It means that we can gather lots of demographic information about that person, and we overlay health inequalities data. So we can see, for people accessing the creative health program, we can overlay through their postcode, the first part of their postcode, where they match our areas of most deprivation, for example. And what we see is people living in Gloucestershire's most deprived areas are overrepresented in our creative health programs. So we are supporting the people that I would say we should be supporting the most. We also overlay things like ethnicity to again see are we making sure that we're reaching all of the population that we should be through these programs. We also then have health utilisation data. Due to the NHS number, we can see health utilisation. We see in the main, health utilisation goes down after accessing the programme, especially urgent care.
We're really talking about the way that people live their lives, their daily stresses, their daily ups and downs, their ability to respond to that and be able to cope with it. And that's where the art of public health for me sits. It's in the space in which we are dealing with the bits of humanity and population health that don't fit neatly onto a diagram, that are really hard to count to turn into a widget. And they're usually the bits that are really hard to change, but they are the bits that are most fundamental to what make us healthy.
We should think about basic needs: creativity, quality of life, housing, heating, light, food, clothing, toiletries. 3.8 million people in 2022, including 1 million children, did without 2 or more of those 6. What about creativity? What about meaning and purpose? Creative health is actually dealing with that fundamental dimension of who we are, of what it means to be a person. Creative endeavors can be a crucial part of leading a life you have reason to value.